September is National Vascular Disease Awareness Month, and although vascular diseases affect 40 to 50% of the population, many of these diseases are not well known by most people. Here to tell us more is Christina Hobbs, a PA from the Corewell Health Vascular Surgery and Vein Center. What is vascular disease, and what are some ways to prevent it?
So vascular disease has to do with the blood vessels that are coming either from our hearts, which are the arteries, or heading back to our hearts and returning the blood to our hearts, which we refer to as the veins.
Okay. And what can we do to prevent it?
So really a lot of the things that we recommend for healthy living: staying active, eating a healthy diet, not smoking, and then if you do have any health conditions such as high blood pressure or diabetes, managing those with your primary care physician.
So what are some of the differences between artery disease and vein disease in the legs in terms of what it feels like, what it looks like, and when it bothers you?
So arteries are going to be the symptoms that happen when you're trying to walk and move around. So people will describe cramping pain when they're walking. That could be in the calves or the thighs, even the buttocks. And it usually happens when they're walking, and then if they rest, it'll clear up, and then it'll return when they resume walking again. On the opposite end, veins tend to be better when they're active and walking, but they'll get this heaviness, this achiness, and those patients will experience those symptoms after they've been standing or sitting a lot.
Spider and varicose veins are vein diseases that I think a lot of people are familiar with, right? What are some things that we can do to prevent them?
So with spider and varicose veins, you're also trying to live a healthy, active lifestyle. You're trying to keep that blood pumping up and out of the legs by working your calf muscles. So walking, swimming, any type of cardiovascular exercise is helpful. In addition, using sunscreen, avoiding prolonged periods of sitting or standing, and wearing compression stockings, especially if you are going to be in a position where you're sitting or standing a lot.
Christina, talk about these free vascular screenings that will be going on throughout the month of September.
So September is Vascular Awareness Month, and so in honor of Vascular Awareness Month, we are screening people for 3 types of conditions: carotid artery disease, which are the blood vessels in our necks, abdominal aortic aneurysms, which are the blood vessels in our belly, and then also peripheral arterial disease, which are the blood vessels in our legs. These are quick, brief ultrasounds where we would examine these areas, and you can contact our office by calling 616-391-VASC and scheduling a screening.